themselves are wasted 1 minute, but there's no secret that one of the best things that you can do for your health is just to move your body. And one of the biggest recommendations is to try to get in at least, 30, and if you can, up to 50 minutes of moderate intensity activities, at least 3 to 5 times a week. The one thing that I care more about is just being consistent with your whatever you want to do, being consistent with your exercise, being consistent with your routine. That also incorporates putting in effort into what you're eating. Um, Never used to be a big fan of counting calories, but there is some importance in doing that and making sure that you're eating the appropriate foods, making sure that you're utilizing, adequate protein, utilizing, uh, decreasing the amount of processed foods that you're eating, but just making your own foods and understanding that your metabolism plays a factor, but there's ways that you can help your metabolism to break down fat a little bit better. And that comes with nutrition, that comes with understanding how many calories you get with protein, how many calories you get with fats, how many calories you get with carbs, and the importance of things like fiber when you eat, little things you can do slowly over time. One of the things that I do find is that doing something that is super easy, super beneficial, something that everybody should be doing. And the biggest example in my life has been my dad. My dad has never been a gym person. He never really gone to the gym to work out. The one thing he does do on a consistent basis, pretty much every single day for the past 79 years of his life, is that he goes on a walk. He goes on a walk every single day. No matter what the weather is, no matter how hot or cold, he will go out and go on a walk. And granted, I'm only doing 20 to 25 minutes. My dad is doing anywhere from 30 to an hour, sometimes 2 hour walks on a daily basis. And I think that's been his secret. And there's enough studies, there's enough research that kind of shows that doing things like that consistently over time is a lot better than going on those 5Ks. I'm not hating on the people who run or anything like that, but more or less to show that you can do something as simple as just walking on a consistent basis, and that'll help with your metabolism, that'll help with weight loss, that will help with maintaining weight. So if anybody who just logged on here, this is, Dr. Isang just stressing the importance of daily exercise, and it can be as simple as walking. Now I'm supposed to be on the other side so I can see the cars coming, but yeah, that is it. And in addition to, I said walking, exercising, watching your nutrition, one of the things that I've been struggling with for the past several years, probably even up to a decade, has been my sleep schedule. My sleep has been, I wore the wrong glasses. My sleep has not been the best, but um, today I actually got good amounts of sleep. Forgot I was the EKG reader, so when I remembered, and then I saw I had about 200 EKGs to read, that was not fun, but um, your sleep is going to be very important aspect of your overall health. And if people can hear me, making sure that this mic is working, just just sending the message, I hear you. Make sure I haven't been talking for the past 5 minutes to nobody, or no one's been hearing my audio. But one of the things that I'm utilizing walking to do is to help with my blood pressure. I think it's one of the good things to know that is that I'm in okay shape, but I still do have elevated blood pressure, and mine is a combination of some lifestyle, poor lifestyle choices, but also genetics. With both my parents having high blood pressure, and even when I was a lot skinnier, I still had elevated blood pressures. And it's important for people in our 30s to understand this because we can hopefully prevent something bad from happening in the future. Uh, a lot of people who I end up seeing, who I've actually just seen, he was in his 60s and was just coming for a community event. And thankfully, in our community event, we also check ultrasounds and blood pressures. His blood pressure was through the roof, and he had no idea. I think it was in the 150s, 160s, but he also had an aneurysm um, of his aorta. And granted, his aneurysm isn't bad, and it won't lead to it rupturing, hopefully. It's good for us to know so that we can monitor it over time. Um, because if it grows over a certain length in a year, it meets indication for it to be repaired. I think his was 4 centimeters. So if it went to like 4.5, 4.6 centimeters, then we would need him to see a vascular surgeon, sorry, a cardiothoracic surgeon about repairing it. But at least he knows now, and he knows that there's two things that can, three things, but hopefully he doesn't have the third. Three things that can make those aneurysms worse. The first one is going to be smoking. He is a smoker, so we talked about the importance of smoking cessation. Um, the second one is high blood pressure. You know, the higher the blood pressure is, the harder the heart has to work, the harder that the arteries have to work, which can also make that aneurysm worse. But also family history. If there's a family history of someone who's had an aneurysm, and especially if they die from the aneurysm, then that gives us heightened concern to maybe just watch this a little bit closer. Maybe instead of getting a repeat ultrasound in 1 year, we get it in 6 months, just to make sure that it hasn't progressed over time. So I love these community events because I love community events, and especially in communities that don't get exposure, low income communities. So we can hopefully prevent for this individual his aneurysm from rupturing. But I saw a lot of other different cases of other different interesting cases that needed follow-ups. The biggest one is that they weren't having any symptoms, so it's difficult for them to understand that, hey, if I don't have any symptoms, why do I really need to see you? And that's the first question I asked them, or I told them to ask me, because you don't want to seem like you're pushing something towards them. So a lot of times the heart will, and has been for this individual, um, trying to do it on his own, for lack of better words. The heart has been trying to squeeze effectively, even though there's underlying issues. And it can do that for several weeks. It can do it for several months. It can actually do it for several decades. But it comes to a part where the heart gives up. And when it gives up, it's not just going to be like, okay, let me go rest a little bit. Let me go chill out, and then I'm going to get better. No, when it gets bad pretty quickly. They come to the hospital for heart failure. They sometimes need to be put on pumps to help keep their blood pressure up. They sometimes need to be transferred to a higher center for heart surgery, transplant, LVADs. So our biggest goal is to prevent that from happening. And one of the ways is just to watch symptoms, but to watch it closely. Right now, they're not having any symptoms, but that could be for two reasons. The first one is when people's hearts have been damaged, but they're not having any symptoms, we sometimes change our activities to meet the body's demands or lack of demands. So they'll say, I don't have any symptoms. I'm not, um, my leg is hurting. I'm not having any symptoms. I don't have any chest pain, no shortness of breath. Then you ask them what do they do, and they kind of talk to you and they say, hey, I don't really do much. I sit on the couch. I go from my bed to the bathroom, take a shower, and then to the couch. And do they make food? No, they order food out. So they've changed their lifestyle to meet the body's demands or lack of blood flow, appropriate blood flow. So one of the things that we can do when someone is coming in with, you know, the heart's not functioning appropriately, but they don't have any symptoms, is to do a stress test. And what we do is sometimes just get them on a treadmill and see how they perform. If they perform well, then we're back to the drawing board. But usually they don't perform well because they've been compensating. Um, but if the heart's not pumping appropriately, we have to figure out why. Is it due to a potential blockage that has been missed? Been walking for 14 minutes, so I got about 6 more minutes of this walking. If anybody has any questions, leave it in the comments, and I'll do my best to answer it. But if the heart is not uh, functioning appropriately, it will change, and people will have symptoms. And if they don't, it's because they've changed what they used to do. So, stress tests can be very helpful, especially a walking treadmill stress test to kind of see if we can elicit some symptoms. If we can, we will then put them in a cardiac catheterization to make sure that their heart not functioning appropriately isn't due to a potential blockage. If it is, then we put it in a stent, open up the blockage. Hopefully, they feel better. Sometimes, if they um, have significant blockage, then we have to consider open heart surgery. All right, I'm running out of topics, so somebody give me something to talk about. Um, I was struggling with that uphill one, trying to walk and talk. I don't understand how some of these people do it, fitness people do it, while exercising and telling you what to do. JDL said, Diddy. Well, I ain't got no comments about that one. uh, so, a lot of this encompasses our weight, and the weight encompasses blood pressure. So, elevated blood pressure is going to be one of the biggest things that we see. Um, One of the most frequent questions someone will ask me is, what are the things that we can do to treat our blood pressures naturally? Uh, and there's so many different ways that you can attack this. The first one is, do you have high blood pressure? A lot of people will um, check their blood pressures in the office, and it's always abnormal. But then when they check it at home, their blood pressure is normal. They could have something called white coat hypertension, where their blood pressure is elevated in the office and normal at home. Best ways for us to know this is to keep on checking blood pressures at home, bring in logs, make sure they're normal. Sometimes bring in your blood pressure machine to the office to make sure that the two numbers agree with each other. And if they do, then likely they have white coat hypertension. Um, One of the things that we always stress is people not to use the blood pressure, the wrist blood pressure cuff, just because there's no correlation or hasn't been proven to be as accurate as the one that goes around your biceps. So, to the best of your ability, try to get ones that fit around the biceps. Um, they come in different sizes too, so don't. If one doesn't fit, you may need to upgrade to a large or an extra large. And I think they even make 2X larges because we really want to get an accurate blood pressure measurement. Do the gritty for $10. Nah, son. You gotta add a few more zeros. I work pretty hard. You're not gonna be catching me doing the gritty. When you telling me you pay off my house, I'm gritty all day. Um, but I was on blood pressure, yeah. So making sure that we have accurate measurements of blood pressure is going to be the biggest thing. So when someone does have elevated blood pressure, we want to know exactly, how high is it compared to 120, where we want it to be. If it's in the 130s, then we can look at lifestyle changes to be more than enough to help with this blood pressure. If it is in the 140s, then sometimes lifestyle changes may not be enough, and other things need to be done to help with that blood pressure. And it does it may incorporate utilizing medications for it. All the medications work well. They do have side effects associated with it, so you have to know that and have that discussion with your medical provider to choose the right one, choose the best one for you if you do have side effects associated with the blood pressure medications. For instance, some of them can cause high potassium, some can cause low potassiums. So you don't want to use the one that causes high potassium if you have a baseline high potassium. You may want to use the one that causes low potassium if you have high potassium because they would work well together. Some are notoriously known for causing ankle swelling, and if you already have some swelling in the legs, you may not want to use that one too. Some can cause low heart rates. So if your heart rate is already in the low 60s or even in the 50s, you definitely don't want to be on that one. So they all work well. And uh, in addition to starting that, and when the lifestyle changes, one of the things you have to, ask is there something else causing my blood pressure to be elevated? Obesity is one of the biggest causes. Excess sodium, so nutrition is a huge cause of it too. Um, Sleep apnea is a huge cause of it. Renal artery stenosis, not a huge cause, but can cause it where you have blockage in the arteries of the kidneys that can impair flow and lead to elevated blood pressure. And not just that, you have elevated blood pressure that's difficult to control with multiple medications. Your thyroid, hormones, menopause, perimenopause, those can all cause it. Those are examples of secondary hypertension where your blood pressure is elevated due to something else. So it's always important to, follow up with your medical provider to make sure that you don't have a potentially preventable cause of your blood pressure being so elevated. I'm gonna give it like 2 more minutes to try to answer any questions anybody may have. And if nobody does, I hope you guys have a blessed day. Have a great day. And we'll be back later, probably later in the afternoon, maybe later in the evening, to answer some questions regarding your heart and your health and prevention. I think I've hit my 20. Yeah, I hit the 20 minutes. Boom. All right, I'm gonna walk all the way up to the hill and then back down and then call it a day. All right, the last topic that we'll talk about, just because I have time, is chest pain. So, as a cardiologist, chest pain is probably the biggest thing that I see between that and palpitations or abnormal sensations of heart rhythm. But chest pain uh, it can ruin people's lives. It can ruin their quality of life, quantity of life also. When someone has chest pain, the pain that gets concerning for me as a cardiologist is pain here, pain that gets worse with doing this, pain going on a hike, going on a walk, going on a run, pain that's worse with stress, and pain that gets better with rest or a medication called nitroglycerin. So if you have any of those three, we definitely want you to be seen in the hospital as soon as possible, because if you have that and some blood test that's positive, then you may need cardiac catheterization to look for blockage. If there's blockage, we fix it. We open it up with a stent. If there's a lot of blockages, then we have to consider open heart surgery. Sometimes when they come to the hospital, they're, oh, I think that's a dog over there. Nope, I'm gonna just turn around. I ain't got no shame to say that I'm afraid of dogs. But if you don't have any of those symptoms, then we will do further testing, such as a stress test or an echocardiogram to look at how well the heart is squeezing. If there's any issues, then we would proceed with a cardiac catheterization. Sometimes people are negative for all of those. Negative blood test, negative echo, negative stress test, then we have to look at other potential causes of their chest pain, other non-cardiac causes. So things like inflammation of the gallbladder or the pancreas can cause it. Cholecystitis, pancreatitis, reflux can cause it. Sometimes anxiety can cause it. Inflammation of the heart, pericarditis can also cause it too. So there's a lot of different things that can potentially cause this to happen. So if all the life-threatening, life-concerning things that can kill you quickly have been ruled out, then we will look at non-cardiac causes, have you follow up with your medical provider, if everything looks good, then we have to potentially look and decide that maybe it wasn't a true issue with the heart itself, and something else may be causing it. So following up with your medical provider is going to be the biggest recommendation. Dr. Isang here giving information regarding heart health and prevention. So if you guys have any further questions, any further issues, let me know. I'm going to give it about a minute, and then I'll head in or head out. I'm gonna go check if that. Oh, yeah, that dog is still there. I can see you. All right, no further questions. I'll check you guys on the next live.